Welcome back to the AI Research Roundup. I'm your host, Alex. Today, we're looking at HealthBench, Evaluating Large Language Models Towards Improved Human Health, published May 13, 2025. Alright, this paper introduces HealthBench, an open-source benchmark to assess LLMs in healthcare. It's quite comprehensive, using 5,000 multi-turn conversations. These are basically extended dialogues, evaluated by physicians with detailed rubrics, which are specific scoring guides. A key takeaway is the significant progress seen in model performance, with newer and even smaller models showing impressive gains on this more realistic evaluation framework. And it's great to see they've also released the implementation for this HealthBench work. So the code is part of their Simple Evals GitHub repository, which is a lightweight library for evaluating various language models, and they've included the HealthBench scripts there, which is good for transparency regarding their model accuracy numbers. Okay, so Figure 1 here gives us a nice visual of how HealthBench actually works in practice. On the left, you see an example conversation. A user is worried about their baby, and the AI assistant responds. Then, in the middle, we have the assistant's candidate response. And to the right, this is where those physician-written rubrics come in. Each criterion, states that the infant may have muscle weakness, or includes advice to seek medical care, has points, positive or negative, and the system checks if the assistant's response meets these. The final score, shown at the bottom, reflects how well the response did against these specific medical guidelines. Alright, so building on how those HealthBench scores are calculated, Figure 2 shows us something different. It plots these scores against the inference costs for various OpenAI models. Inference costs, by the way, is essentially how much it costs to run the model to get an answer for one example. We can see a really interesting trend here. As we move from older models like GPT-4 from June 23, which is in the bottom right with a lower score and higher cost, towards newer models like O3 from April 25, in the top right, the scores generally go up, and sometimes the cost even comes down. Or smaller, more efficient models like GPT 4.1 Nano achieve pretty good scores for their cost. This chart really highlights the performance cost frontier, basically how much performance you get for your money. Okay, so we've talked about how physicians are key to HealthBench, writing those detailed rubrics and evaluating the AI's responses. Well, Figure 3 here gives us a sense of just how broad that physician involvement is. This world map shows that the HealthBench physician cohort, the group of doctors they collaborated with, brings practice experience from 60 different countries. This global representation is really important for ensuring the benchmark reflects diverse medical practices and perspectives, making the evaluations more robust and widely applicable across different healthcare contexts. Alright, so we saw earlier in Figure 2 a kind of performance cost frontier, while Figure 4 here shows a different kind of frontier. This is the HealthBench performance frontier over time, specifically for OpenAI models. The x-axis plots the model release date, and the y-axis is that HealthBench score we've been discussing. That blue line charts the path of the top-performing, or frontier models as they were released, starting with GPT-4 in mid-2023 and showing a pretty steady climb up to the O3 model in early 2025. The gray dots, those represent other models that didn't quite make that leading edge. Okay, so while Figure 4 showed us that overall HealthBench score progression for OpenAI models, Figure 5 now gives us a more granular view. This bar chart breaks down the performance of a wider range of models, including O3, Grok 3, Gemini 2.5 Pro, and others by specific conversation themes. So we're looking at how well each model handles topics like emergency referrals, which they generally do well on, versus context seeking or global health, where scores tend to be lower. It's clear that even top models show varied performance across these different themes, highlighting specific strengths and weaknesses. Okay, so after looking at average performance across themes, Figure 7 here gives us insight into model reliability. This plot shows the worst-case HealthBench score as the number of samples, quote, increases for several OpenAI models. This worst at K performance essentially tracks the lowest score a model achieves within a set of K randomly chosen test examples. We can see that as K goes up, the worst case score for all models tends to drop, which makes sense. The more examples you look at, the more likely you are to find a really poor one. However, models like O3 shown in blue consistently maintain a higher floor for their worst performance compared to earlier models, even out to 16 samples, suggesting they are becoming more reliably good. Okay, so we've seen how model reliability is improving. Now Figure 6 shifts our focus back to a different kind of performance breakdown. This chart looks at scores across 5 key evaluation axes. These include, quote, communication quality, instruction following, and accuracy. Then there's context awareness, which is the model's skill in remembering and using what was discussed earlier, and completeness, or how thoroughly it answers. We see models generally score higher on communication and accuracy, but lower on context awareness and completeness, though the O3 model, for instance, shows a nice jump in its completeness score. So looking at these different performance angles, from themes to reliability to these evaluation axes like context awareness and completeness, it's clear that HealthBench offers a really valuable framework for tracking how LLMs are evolving for health-related tasks. While we're seeing definite progress, this work really underscores that achieving consistently reliable and complete AI assistance in healthcare is still a significant goal. Rigorous benchmarks like this are vital as these technologies develop. Thanks for tuning in to AI Research Roundup. I'm Alex.